Hi, my name is Caitlin Whitehead, and today I'm going to be talking to you all about radiologic technology professions. Radiologic technology has to do with professions that involve x-rays, chemotherapy, and radiation, just to name like a few aspects of that profession. I found this profession to be pretty interesting just because there is a wide range of work, and it even though they are professional health professions, they weren't you just go to medical school and boom, you're a doctor. However, there were many options from just getting your associates and going straight into the work field, which I found to be pretty interesting. One profession that I researched was a radiation therapist. They are responsible for administering the treatment for cancer patients. If you have known anyone that has had cancer and has had to go through chemotherapy, then they have a radiation therapist in their life. The work settings include like clinics and hospitals, sometimes labs. So for education required, you only need an associate's or a bachelor's degree in radiation. Then you would need your state license, which to be in any hospital setting, you really need your state license. And then you need your ARRT certification. The average salary is about $82,000 per year. The job outlook is 9%, which is really good. And some organizations, one being the American Association for Radiation Oncology, which I found really cool, that there was one specifically for radiation. There was a professional health organization just for radiation for people in that profession. Another one, this is the most interesting one that I found, the profession of being a nuclear medicine technologist. I found this to be interesting. Well, I'm going to talk about it after I finish telling you all about it. Okay. So, a nuclear medicine technologist, they perform tests that help diagnose patients' ailments and that help to treat them. They administer small doses of radioactive materials and then they record the images of results. So in my mind, I'm thinking, okay, so this is a doctor, but it doesn't say this is a doctor, it's a technologist, which I found that interesting because usually only doctors and nurses and physician assistants are allowed to administer drugs and things of that nature, especially with this being radioactive. But turns out you do not need your doctorates. They also inspect the equipment, explain procedures, and document work, which I find that so. In my head, as technologist, I'm guessing now the person works on the equipment. The education required, you need a certificate, associate's, or bachelor's degree in nuclear medicine technology. And then you would get your certificate from the Nuclear Medicine Certification Board. The average salary is around $76,000. The job outlook is around 7%, and an organization is the Society of Nuclear Medicine and Molecular Imaging, which, if you are really into x-rays and radioactive technology, that is an organization for you. Okay? So lastly, I looked at the profession of being a radiologist. This is probably the most common profession that we have heard of within the radiologic technology. So radiologists, they execute and interpret medical images to aid in the diagnosis and treatment of patients, which, like any doctor, to be honest, except for the fact that they specialize within those x-ray images and such. Their work settings includes labs, hospitals, and clinics. The education required, you would need a Doctor of Medicine degree from an accredited medical school, and then you would need your medical residency, and then you would need a state license. The average salary is around $300,000 per year. The job outlook is around 7%, and some organizations include the American Board of Radiology and the American Association of Physics and Medicine. To wrap up this presentation, I would like to say that at first I was only looking at professions within, I was looking at professions within the healthcare field by being a surgeon, but the radiologic technology is actually, it has a high demand for jobs, and it's pretty interesting. and I enjoy this project. Thank you for listening.